Hi, this is Dr. Bande Virgil. I'm here to talk to you about coronavirus and answer some of the frequently asked questions that I receive.
Isn't the coronavirus just like the flu?
That is a great question, and I get that question quite a bit. No, the coronavirus is unlike the flu. In fact, the coronavirus, which we call the novel coronavirus, is unlike any other virus that we have really encountered in the last century. It is much more aggressive. It lasts much longer in patients and can be passed easier than the flu. So the death rate is actually even higher with coronavirus than it is with the flu. For the flu, it's roughly about 0.1%. With novel coronavirus, it's 1%. So that is a huge difference. They are not the same. They have similar symptoms: fever, chills, body ache, diarrhea, coughing, sore throat. All of those things overlap, but the underlying cause is very different.
So why is everything shutting down, or are we just overreacting?
That is another question that I get quite a bit. No, we are not overreacting. Unfortunately, because coronavirus is such a new virus, there is no vaccine for it. There is no medication to treat for it. So therefore, all we can do as a nation, as a community, as a global community, is try to minimize the number of people who get novel coronavirus. So what we do by shutting things down or minimizing interactions socially, including closing schools and, turning down concert events, stopping NBA activity, is minimizing our interaction with each other to minimize the spread of the virus from one person to another. It's done by touching surfaces and droplets that spread and can lay on someone. So if we can create some social distance from each other, then we can actually help decrease that curve of new infections that can cause a huge challenge for healthcare systems to address. So when you socially distance yourself from colleagues and people that you engage with that are not family, it actually is helping the public health system, doctors, nurses who are on the front line, take care of the most sick and the most vulnerable patients, and it matters.
How do I prepare?
The best way to prepare to experience novel coronavirus is through getting your basic hand hygiene products. So I have a couple of them just kind of in front of me. I'm not endorsing any of these particular products, so you can just use other brands, but Lysol bleach, this is Lysol wipes, and hand sanitizer. I don't have soap in front of me, but soap and water are also really essential. What you want to do is remove the viral contact from your hands often. So you're going to wash your hands for at least 20 seconds. Lots of cool songs are out there to help you remember happy birthday. You can sing with your kids, other songs to help you remember how long to wash your hands. In addition, remember not to touch your face. The virus actually enters your body through your mouth, your nose, and your eyes. So it's very important to have your hands clean, minimize touching your face. It is also important to realize if you are a vulnerable person or someone who is in the general population. Novel coronavirus infects everyone. However, there are certain groups of people that are much more affected by it. So those are people over the age of 75 and anyone who has a chronic condition. So chronic respiratory issues, issues with your lungs, diabetes, hypertension, immunocompromised state. It is absolutely important that if you are in those categories that you are even more vigilant with your hand washing and your social distancing. It's important to talk to your physician and make sure your medications are completely up to date and that you are staying in communication via phone if your symptoms change and you are worried about having coronavirus.
Where do I get tested?
That is a great question. Testing has been a challenge. That is really what brought us to where we are with this disease. we have not had the capacity to do testing. And so therefore, we have been delayed in identifying cases in our communities across the nation and honestly across the world, which is why we have to rely on social distancing so much. Here in Columbus, Georgia, we are currently now starting to have increased kits that will test for coronavirus. You can get that done actually now at Piedmont Northside Hospital. You can go to the ER and they have an area where someone is asking screening questions with regards to coronavirus. Additionally, you can call your physician ahead of time if you think that you have symptoms and you need to get some additional information. Please do not just show up, make sure you call. Thank you so much for your time and attention. I hope that you found those questions that were answered helpful. Please write additional comments below, like, share, subscribe, and pass this on to anyone who you feel like it would be helpful to. Thank you so much.